There's an increase in physical activity and gym memberships as COVID-19 lockdown regulations ease. This is according to Discovery Vitality. A research paper in partnership with Wits University has been surveying South Africans' level of physical activity during the lockdown. The study also looked at links between exercise and COVID-19 outcomes. Ahmed Kajee takes a look.
Research conducted by Wits University in partnership with Discovery Health is the first known survey to examine adverse outcomes in a large cohort of COVID-19 positive patients using recorded physical activity data. The study, which has been published in the British Journal of Sports Medicine, included physical activity data which was directly measured from 65,000 adult Vitality members with a COVID-19 diagnosis from March 2020 to June 2021. Data from 2021 showed that individuals who are more likely to exercise often, eat healthier foods, and have better health screening outcomes have an 81% lower risk of death from COVID-19 than those who are not engaged in exercise. The members were categorized into groups by activity level: low engagers who exercise less than 60 minutes a week, moderate engagers who exercise 60 to 149 minutes a week, and high engagers who exercise 150 minutes or more a week. Their physical activity levels were then linked to the risk of hospitalization, admission to the intensive care unit, the need for ventilation, and death due to COVID-19.
Those who exercised at recommended levels, 150 minutes a week, is not actually a lot. 5 sessions of 30 minutes a week, moderate to high intensity, had a 42% reduction in hospital admission, 47% reduction in death. It's really quite astounding.
Gyms and other physical activity facilities were closed due to COVID-19 regulations in March 2020. The study also found a 49% decrease in physical activity logged during the hard lockdown. With home fitness becoming a norm, Vitality says wearables such as fitness trackers have resulted in some groups continuing to exercise at home during the various lockdown levels. Speaking towards the frequency of exercise, Patricia says people should make exercise part of their daily routine.
But also you'll find that people who exercise regularly and are in a more of a routine, it actually creates a better regularity to their lives. So I use the analogy of brushing your teeth. If I said to everybody here, don't brush your teeth for 5 days, you'd be horrified. But it's exactly the same with exercise. It should be an essential part of what you do to preserve your health.
Despite the reduced levels of exercise since March 2020, Discovery says while some are returning to gyms, there are 3 groups of people who haven't.
The first is people who are still scared. Right? There's still people hesitant to go into public places. The second group of people who aren't going regularly anymore, people who found during lockdown found different ways. They've set up their home gym and they're happy, or they've taken up road running or cycling and they're happy with that. The third group is exactly what you were referring to. There's a lot of hardship out there right now. Lots of unemployment, increasing unemployment, lots of people who have to make sacrifices in their budgets.
Meanwhile, Patricia says another big lesson to take from the study is that exercise facilities should not be completely closed.
And one other thing I want to mention, and it's not a criticism of policy because we didn't know where we were 2 years ago with COVID, was one of the messages we wanted to send from these studies was that we should never ever restrict exercise completely. You know, we should always find ways of facilitating exercise in whatever scenario we're in.
With the findings of the study indicating the benefits of exercising and the physical activity trends during lockdown periods, researchers say there are 2 main shortfalls. The first one is that the study cohort were all medical aid members, which could imply a selection bias on affordability and socioeconomic status. The second shortfall was based on a lack of specific qualitative data around demographic information and specific health measurements of members.
For Newzroom Afrika on Channel 405, I'm Ahmed Kajee in Sandton.